Hello, everyone, and welcome to our team meeting here on our Saturday. And I'm not sure where you're calling in from, if it is morning or evening or afternoon for you. We heard from all over the world actually today, and there's a great reason for it. Now, we've been doing a lot of meetings here in the North American market, and a lot of you have seen we've had so much growth. Well, one of the things that I think has been instrumental in the growth in the North American market is many of our meetings that we're doing and some of the events, we're having this speaker answer people's questions. And just from what he is telling us about the products or the effects, there's so much in that just gives us that belief that we are in the right company, talking about the right products on the right mission to get the word out, working towards our 1 million in balance. So as this call is for partners in Xeno, we are going to be talking about our health protocol today. And so actually, I think we'll just use 5 minutes on just talking quickly about how important the health protocol is for everybody. And then we're going to open up for getting your questions answered. So I know a lot of people have a lot of questions as partners. And so we're going to let you put them here in the chat. Yes, you can start your questions, but I want to be very specific on one of the things that we really don't want to do is be very specific about certain cases and with certain disease names. So it would be great if we could kind of just go steer around those exact names and wording, if you wouldn't mind doing that. But yes, go ahead, start your questions in the chat, and we have people checking out the chat so that we are going to try to get everybody's questions answered. Now, Dr. Paul, we're not going to go into detail about what the health protocol is because most people on this call are partners and know exactly what the health protocol does. But just one question before we get to the question, one question to you before we get to all the other questions is, how important do you see the health protocol in making a difference in the global health? Dr. Paul Clayton. Hi, Paul.
Hey there. Well, thank you for saying that I add credibility. I don't think this hat adds any credibility whatsoever. I think I wouldn't even buy a secondhand car from someone who looks like me, but I can assure you that where I am, hats are necessary. The sunshine is fierce down in the south. So what does the health protocol do for public health? Basically, what it does, it enables you to create your own blue zone. And for those of you who are not yet familiar with the concept, blue zones are islands, usually defined geographically, but one or two defined historically, where people have much better health than the health you see in the public arena today. Public health is a mess. It's dotted with red flags. I've just written yet another post looking at the increasing incidence of dementia. And the expert panels reckon that within the next 20 years or so, it's going to treble, at least, from the figures that we have now. I think that's a conservative estimate. And you see with almost every other condition or disease that you want to specify, all of these things are getting worse. More people are becoming affected by them. More of our children are developing them early in life. We're in a situation where all the trends are negative. Now, if we continue down this road, we'll get to a point where every man, woman, and child is pharmaceutically dependent. We can't afford to do that. And long before we got there, the money would run out anyway. It turns out that the pharmaceutical model is simply inappropriate to use if you're aiming at improving public health. The drugs that we have access to are too toxic to be used prophylactically and too expensive. It turns out the only way you can improve public health is by improving the food chain. Okay, all right. And if I would have said that to you 10 or 15 years ago, I wouldn't have been able to say anything very specific about it. I would have simply parroted the government advice Yes, eat a balanced diet, eat more fruits and vegetables. But we can be more specific than that now. I'm just going to switch this off because the science has moved on. We're now at a point where we can say very reliably, on the basis of very robust evidence, these are the things in the modern diet and lifestyle that are making us so sick. They've been identified, and they include chronic inflammatory stress, which you all know about, but they also include type B malnutrition, dysbiosis, and glycemic mismatch. Those are the four mechanisms whereby the modern diet and lifestyle is making so many of us so sick. So once you've got to that point, we can then begin to propose antidotes. And that was the intellectual and evidence-based foundation for the health protocol. Simple as that.
I love that. And I think all of us know how important our health protocol is. But now that person is already asking, how important is it to get down into the 3-to-1 balance? So 3-to-1, 1-to-1, is there a difference from 3-to-1, 2-to-1, 1-to-1? Is it best to be down to 1-to-1, or what are those numbers, under 5-to-1, what the US says, or what is the exact number that you would say? Is there a difference in regards to, different things that people have?
Okay, it's a little bit complex. The Scandinavian Council of Health Ministers have their consensus view that you should be below 5-to-1, and I think that's a good place to aim for. But you don't have to be quite as low as that if you're eating very large amounts of other anti-inflammatory compounds, such as polyphenols. So we have a little bit of room and error. It's a fuzzy system. It's based on fuzzy logic. If you're not eating very many polyphenols, you need to be lower on your 6-to-3 ratio. If you do not yet have an obvious pathology, probably getting down below 5-to-1 is going to be fine. That's an adequate holding pattern. If you already have a condition where there is a lot of chronic inflammatory stress, you may need to come down below that 5-to-1 to 4, 3, 2.5, 2, or even lower to stop that disease process. So there is no one ideal figure. It kind of depends on the rest of your diet, certain other aspects of your lifestyle, and your current health.
Okay, love that. So there are things, so if you could get closest to 1-to-1, would that always be the best?
Well, no, as I said, there isn't a single magic number that you need to aim for. I would say that if you have a very serious health condition and you are in pain, you have disability as a result of that condition, you may need to bring the ratio down that low in order to switch the process off entirely, to give you a chance to recover, to alleviate the pain and the stress that that condition may be causing. If you're going to go down as low as 1-to-1, then the possibility of interactions with certain other types of drugs does begin to become real. So for example, at that point, you're going to see clotting time extending, and if you're on blood thinners, there could be a complication there, so you should be aware of this. And if you bring the ratio down, really down low to close to 1, and some people, for whatever reason, decide they want to go below that, at that point, you have switched off the inflammatory sequence so effectively that you now begin to move towards being immunosuppressed. Now, there are certain situations where you might want to do that. For example, if you're trying to deal with a transplanted organ, but for most of us, that's really not where we should be aiming.
Okay, good, great. So a lot of people are asking things in regards to, different issues in the brain. There could be there's different issues in the brain, but how effective is our health protocol for that? Or would you always add Viva?
There is evidence of an inflammatory component in both anxiety and the anxiety states and the depressive illnesses. And there is evidence in the scientific literature that reducing chronic inflammatory stress may be helpful in alleviating these conditions. I think that Viva is a really important ancillary tool. Preventing chronic inflammatory stress in the brain is really good for your long-term cognitive health. But if there is an acute problem with anxiety and or depressive illness, Viva has the ability to alleviate those symptoms, and very, very quickly with balanced oil. there is a certain lag phase because it's just going to take time to achieve that switching around of your essential fatty acids in your cell membranes. That takes time. Viva has the advantage of working incredibly quickly. And for those of you who have experienced this, you'll know that alleviation of symptoms will take place typically within 2 hours of taking the first 2 tablets. So this is almost like a pharmaceutical time period of action. You take an aspirin, within an hour or so, the pain of, let's say, a bruised knee starts to get less. It's the same with Viva. The onset of action is incredibly rapid, and this is what we found in trial after trial after trial. I was involved in one of those myself, so I've seen this both in a scientific context, and I've seen many individual case histories where people have responded amazingly well, amazingly quickly.
Wonderful. Okay, so we have a question here. Michaela is asking in regards to the extend. Now, I know some places they're saying 2 to 4, so I want to hear between 2 to 4. But then she's asking, is 4 really enough?
I think that 4 is a very reasonable number for almost everybody. When I designed the formulation, it was designed to raise a typical modern ultra-processed diet profile, micro and phytonutrient profile, to the level that we see in the blue zones. For example, if you're eating the Mediterranean diet. I'm not entirely comfortable about ramping up your intake of Extend even more after that. I don't think it's going to do you much good. Theoretically, you may start, if you keep on taking more and more of these things, you may start getting to a point where you're starting to increase the risk factors for certain types of problems. So for example, high dose calcium supplements are associated quite strongly in the clinical literature with an increased risk of cardiovascular problems and death, in fact. Not a good idea to be filling yourselves full of calcium supplements. If you take too much vitamin C and you don't hydrate properly, you increase the risk of kidney stones. So I think that there is a optimal range of micronutrients and phytonutrients which we can derive from the blue zone research. And not very much evidence that you're going to gain significant benefits from going above that. Optimal dose for adults is 4 tablets a day. That's specifically what it was designed to do. 2 tablets a day would be for, let's say, if your body weight is below 100 pounds. So that's really more for children.
Okay, that is great information to know, Dr. Paul. Okay, so just a question here from Patricia. Can people that have, either shellfish or iodine allergies also use the products Extend, Balance Oil?
Yes, this is what we find. We don't see any problems there, and I certainly would not have predicted any problems. If you have an allergy to shellfish, then what you're allergic to in almost every case is to shellfish protein. There is no shellfish protein in either Balance Oil or Extend, so that's really not an issue. With iodine, or as they say in the United States, iodine, you are generally recommended, if you have autoimmune thyroid disease, not to take additional iodine, either in supplements or indeed in iodine-rich foods. However, we've been very conservative when it comes to iodine. We put in enough to ward off hypoiodination, and people not having enough iodine in their diets is now very, very common all around the world. So that's the big market we're aiming for, but the dose is enough to prevent the problems associated with iodine depletion, but still low enough, we think, not to create any problems, even with people who've got, let's say, Graves or Hashimoto's, those the autoimmune diseases that affect the thyroid. If you actually have, and some people have a thyroid cancer, I think at that point, I would say, well, hang on, let's be cautious. Let's talk to the doctor, the physician in charge, and liaise with them.
I like that. Wonderful. Okay, Phil is asking, what is the optimal time of the day to be taking the health protocol?
I don't think there is an optimum time. All I would say is that if you're taking Extend, you should take that with food, because once you eat, the gastrointestinal tract becomes more mobile. It becomes better at absorbing micro and phytonutrients. So to always take it with food. With Xenobiotic, it doesn't really matter what time you take it because you're not going to be digesting it or absorbing it. That's going to go into the large bowel where it becomes a substrate for your probiotic species that live there. With balance oil, there is a timing issue, but that's really more to do with avoiding certain times of day. So for example, it's not a good idea to take balance oil too soon or either before or after intensive exercise. And the reason for that is that if you take it within an hour or so of intensive exercise or within an hour after taking intensive exercise, those lipids from balance oil will be in your blood. You're taking lots of physical exercise, you'll actually start using those fatty acids as fuel. You'll start burning them up to produce energy. And you're then they're not going into the pool in your cell membranes, which is where you want them to be to exert their anti-inflammatory effects. So with balance oil, take it as far away from periods of intense physical activity as you can. That would be the general rule of thumb.
I did not know that myself, so I'm going to change a little bit of the routine. And just because I'm on here, I get to ask things too, Dr. Paul. Would you suggest always taking things then at the same time every day?
No, again, there's no really strong rationale for that. There are certain pharmaceuticals which are so toxic, or where the plasma levels you want to achieve have to be standardized so rigorously that regular dosage scheduling is critical. But that's generally not true for nutrients, where the therapeutic indices, that is the ratio between toxic and safe doses, are so much larger. So the timing, the scheduling of doses that we see with drugs is just generally not a critical thing for foods or nutrients.
Okay, wonderful. Okay, I have a question here from Mukesh in regards to the health protocol and really helping with such the array of autoimmune things. I know we're not supposed to be talking about diseases, but I'm going to, because this is not one specific, I'm going to just say in regards to the autoimmune health protocol and autoimmune. Dr. Paul?
What I can say is that I've seen some really very remarkable success stories in people who've had autoimmune conditions, and I'm one of those. I no longer have an autoimmune disease. I developed Graves' disease 14 years or so ago when I was going through a period of enormous and very severe and chronic stress. And at that point, balance oil didn't exist, but I developed a prototype of it. I was drinking large amounts of fish oil and olive oil. It was absolutely horrible, but I was able to switch off the chronic inflammatory stress to the point where my thyroid was no longer being attacked. And after a while on this regime, my thyroid or my immune system forgot there was a problem. So I don't have Graves' disease anymore. And just for those doubters, it was diagnosed, it was an absolutely classic case, and it was diagnosed by the physicians at Epsom General Hospital. They picked it up right away, did all the blood tests. Yes, I had an autoimmune disease. I no longer have it. I'm euthyroid. So that for me was very personally, very, very helpful. I don't think that's always going to be as successful. I don't have enough of a database to be able to say that. But if you have an autoimmune disease, your immune system is progressively destroying its target tissue, whether that's joint capsule, thyroid, or any other tissue in the body, through a process of very local, focalized, intense chronic inflammation. We know how to switch that off. And this is one of those situations where you need to go lower than 5-to-1. You will need to drop down to 3, 2.5, 2, sometimes even 1.5. But when you get low enough at a certain point, you switch that inflammation off. And all the benefits then start to accrue.
Wow, I love that. Okay, so someone is asking the question in regards to certificate for being metal-free. A couple of doctors have asked them why we are not certified metal-free.
Because we didn't apply for the certification. But I mean, yeah, it's metal-free. The process that we use, which is, I think it's a reverse osmotic filtration procedure, guarantees that you can use analytical forensic material technologies. You'll probably not find any metal at all, or if you do, they're at levels that are so low that they're effectively meaningless.
Okay, wonderful. Deb is asking, if you're taking the health protocol, do you need Protect?
No,
Or is it just a duplication of ingredients?
it's a duplication. The purpose of Protect was to provide a lower cost alternative for people who had very specific problems with inadequate immunity or with allergy. So Protect is helpful for those cases, but if I had the choice, I would always use Extend rather than Protect.
Gotcha. Now I know I have personally, I would take some extra Protect if I happen to feel anything. I don't think I've been sick, Dr. Paul, in so long, but if I kind of felt like something was maybe starting, I would take extra Protect just out of my own curiosity. Am I doing the right thing?
It won't harm you. I'm not sure how much good it's going to do you. It may be a little bit helpful. So yes, it'll do no harm. It may give you that additional little bit of insurance.
Okay, wonderful. So Crystal's asking the question, why would somebody test at 51-1, but when they're having traditional blood tests, indicate that there's no inflammation in their body?
If you can have a very high ratio, but if you are stuffing yourself to the brim with polyphenols at every meal, and this is something we sometimes see in India, then you can still get away with it because the polyphenols have a rather different type of anti-inflammatory effect. So even with a high 6:3 ratio, if you're sort of damping the fires every few hours with high doses of polyphenols, you can get away with that.
Okay,
and one other thing, you have to remember that the tests that we use to detect inflammatory stress are very, very crude. So it doesn't really, I mean, probably the best that's available to most doctors would be HSCRP. CRP, or C-reactive protein, is a protein produced by the liver in response to inflammatory stress elsewhere in the body. It has very, very low, it's completely non-specific, but it is also very low sensitivity, because this is a secondary response to inflammation that may be occurring in only a very small area at a low level somewhere in the body. So you can have rheumatoid arthritis or Graves, and you might not pick it up on an HSCRP. HSCRP will show you inflammation if you have a patient with active pneumonia, because there's a whole lot of inflammation throughout the respiratory tract. Yeah, HSCRP will match that. But if all you have are slow burning fires in a couple of joints, which might not be causing problems now, but which will in 10 years' time cripple you, no, the standard lab tests used by the medics will not pick that up.
Okay, well, that's good to know. So our balance test is a very great indicator of the levels that they need to work on that we can use our balance products for.
It's telling you a great deal about your propensity to develop chronic inflammatory stress. If you have a figure that's up in 50-1, either you have symptoms, which will show you that you have chronic inflammatory stress if you're a clinician and you know what to look for, or those fires are burning at a low level in one or two places in the body, and they will at some point become clinically evident. One of the first places where we look would be in terms of just get out your old sphygmomanometer, check your blood pressure. If you have chronic inflammatory stress, one of the areas where it will often show up first is in terms of endothelial dysfunction, which is another word for another phrase which describes chronic subclinical inflammation of the cardiovascular system, specifically the resistance vessels, your arterioles. As they get more inflamed, they start to constrict. The balance between normal vasodilator and constrictor influence is upset. The constrictors take over. The arterioles constrict. Your total peripheral resistance goes up. Your diastolic blood pressure goes up. So when, as you get older, as time passes, you see diastolic blood pressure starting to creep up, that's a pretty good tell. You have chronic inflammatory stress.
Okay, wonderful.
And that's actually a more effective test and a more sensitive test than HSCRP.
Okay, wonderful. So Jeff is asking, how can you improve cholesterol levels with the protocol, and how important is that omega-3 index on the results of the test in relating to the cholesterol?
Well, first of all, the first important thing to say about cholesterol is it doesn't matter. If you go to my blog and have a look at some of the posts where I've written about cholesterol, cholesterol is really not a good biomarker. We know that about 50 to 60% of all heart attacks occur in people with so-called normal cholesterol. The latest huge meta-analysis of statin studies show that they reduce cholesterol, but they do not protect your health in any shape or form whatsoever. Cholesterol was the wrong marker. The important thing is partly how much cholesterol you have, but also to what extent is it protected from being oxidized, to what extent is the balance between pro-inflammatory and anti-inflammatory factors playing out in the linings of your arteries. So cholesterol is a terrible marker. Don't worry about it. The pharmaceutical industry pushes it because they've got drugs that lower it, but the drugs do not do anything other than lower cholesterol. They don't protect you. Just to give you an example of this, if you take fish oil, that'll actually push up some of your cholesterol fractions. And yet, what we know extremely clearly now is that the combination of fish oil and the olive oil that we use is extremely cardioprotective. We've seen hundreds and hundreds of patients now who were scheduled to go in for example, atheroma removal, for catheterization, balloon catheters to open up coronary arteries. Hundreds. You get onto a waiting list, you end up going into the surgery, they'll scan you to see where the blockage is before they start to cut or put the catheter in there. And what's happening is hundreds and hundreds of people who were on balance oil are being told, wait a minute, we're not going to go through with the surgery. You don't have blockages anymore. Now, they still had the same cholesterol levels as they had when, years ago when the problem started. That's neither here nor there. What has happened is that the balance oil has reduced or stopped the chronic inflammatory condition inside their arteries. And of the oleuropein, which is a very, very interesting polyphenol in olive oil, upregulates something called reverse cholesterol transport. And that describes the way in which certain types of fractions in the blood are able to remove cholesterol from your soft tissues, including the linings of your arteries. So forget cholesterol. And if you want to reduce it, Xenobiotic will do that because that interferes with the biliary circulation of bile acids. It basically drains them from the body's pool, and that lowers cholesterol. But that's not really important. Unless you absolutely obsess about cholesterol levels, you can take Xenobiotic and watch them drop, but that's not really important. Now, the omega index, the omega-3 index, well, we know that's important as well because that is quite a heavily weighted risk factor. It is probably better to have a higher omega-3 index, but I think that only becomes important if you have a bad 6-to-3 ratio. If you have a bad 6-to-3 ratio, improving the index is probably going to reduce your risk profile. But if you have the right index, if you don't suffer from chronic inflammatory stress, if you have the right ratio, I think you can get away with a relatively low index. The one area where this can be a problem, and I've seen this particularly in America, if you're eating an ultra low-fat diet, and there are still cardiologists here who haven't read the research literature for 20 years, they're totally out of date, and they say, oh, well, you have high cholesterol, or you've had a high heart attack, don't eat eggs, don't eat dairy. I mean, it's amazing to me that they still come out with this trash. And so we see people sometimes who have a really low index, but a good 6-to-3 ratio. So they might be, 3, 4, 5 to 1 or whatever, but the levels of both the 6s and the 3s are so low, and they also still clearly have a whole lot of chronic inflammatory stress because their blood pressures all over the place. So, as I said, it's complicated. The human body has a lot of moving parts. The idea that you can simply take one out, manipulate it, and have a terrific effect is just nonsense. That's a pharmaceutical idea. And really, in the research community, that's died. It's only in the minds of doctors that they still think that that's a sensible approach. It isn't. It's not constructive. It's unhelpful.
Oh, and just to promote Dr. Paul's blog, because you can get so much information on there. It is drpaulclayton.eu. And as his publicist says, there's something on there to offend everybody. But we love it because, Dr. Paul, you're telling the truth. So thank you for that. We love you. But let's move on to the next question. Venkatesh says, is asking, if we are on blood thinner, can we still take the balance oil?
Again, I think 10 years ago, my answer would have been, whoa, let's be careful and proceed with utmost caution. Since then, a couple of papers have been published which show that if you're going to use balance oil to come down to a reasonable ratio, 5 or 4 or 3 to 1, it doesn't seem to be much of a problem. Now, I'll backtrack now and say, potentially it could be if you're not monitoring your clotting time. Now, if you're taking an anti-K, anticoagulant, such as warfarin or coumarin, if you're taking those drugs, the doctors or the health system will be monitoring your clotting time once every 7 to 10 days or so. And so if they see that extending, they can start to cut down on the dose of warfarin or coumarin. And that's quickly and easy to do. Nothing, you won't come to any damage there. If you're taking one of the newer drugs, such as apixaban, I think sold in most countries as Eliquis, that's a different mechanism. They don't test for that, your clotting time. And so you could be on that for 6, 12 months at a time without anyone checking your clotting time. The good news is if you take balanced oil, it doesn't seem to interact. I mean, perhaps marginally, but not significantly. But if your doctors have put you on, let's say, Eliquis, and they've also put you on aspirin and maybe something else because they think you're high risk, under those conditions, I have seen someone taking balanced oil, bringing their ratio down to, I think it was about 2 to 1, and they started to develop spontaneous bruising on their arms and legs. And that is a sign that, whoa, your blood's becoming a lot too liquid. And the shock to me was this person had been to see their doctor, who is a very famous cardiologist at a center of research excellence. And this cardiologist had said, oh, it doesn't matter, just keep on going and doing what you're doing, which was grotesquely irresponsible. To my mind, this was someone who was beginning to become at risk. And I said, right away, stop taking the aspirin. Keep on taking the Eliquis. And they stopped taking the aspirin. The bruising stopped. But when you see spontaneous bruising appearing in the arms, legs, or torso, that is a sign that your clotting time is too extended, your blood is too thin, and at that point, it would be wise to start tapering down on at least one of your anti-clotting drugs.
Okay, good to know. So Dr. Paulina is asking, is the Ascent just as good as the balance oil?
If you get the dose right, yes. It's a rather more concentrated form of omega-3s and presented with more concentrated polyphenols. So it is doing the same sort of thing. And if you don't like drinking the oil, the Ascent is an alternative, but you have to take enough of the capsules to get you to that right place.
And I personally have had Ascent Plus that's been making a difference from the Ascent when I'm traveling. So
I think it's great for use when traveling. Hang on 1 second. Okay, where? Here? Okay. Yep. Okay, let's go on.
Okay. So another question. I have Patricia here who said she had a customer who was taking Xenobiotic but was getting a lot of cramping and bowel issues from taking the Xenobiotic. So is wondering, is that possible? Or what would cause that?
Oh, absolutely. That is possible if you have SIBO. That's a small intestine bacterial overgrowth. And that is a situation where, for whatever reason, the probiotic species that do you so much good when they're in the large bowel, if you have dysbiosis, under some circumstances, they can migrate up into the smaller intestine. And now you have to go on the FODMAP diet. You can't be eating fermentable fibers because you're feeding these bacteria. They're fermenting and growing in the small intestine, which is the wrong place. And that is going to make you very uncomfortable. So if that is happening, if you're getting these negative reactions to Xenobiotic, what you need to do is to flush those probiotic species out of the small intestine back into the large bowel where they belong. And you can do that using antiadhesins.
Okay, super. Okay, so Susan is asking if the health protocol is okay for people who have had kidney transplants.
Yes, no problem at all.
Wonderful. And then any organ transplant is, I can see other questions here. Any organ transplant that we would need to think about?
Not that I'm aware of. I think that what people are concerned about are the 1,3,1,6 beta-glucans that do improve certain aspects of immune function. And of course, you don't want to have an overreactive immune system. We want to keep it quiet, which is why you use immunosuppressants in people who've had transplants. But the important thing to know about the 1316 beta-glucans is they're acting almost exclusively on the innate immune system. So the big impact is on your macrophages, neutrophils, Kupffer cells, Langerhans cells, and they're not involved in graft-host rejection reactions. So there's no worry. We also know, and I used to chair the scientific advisory board for Biothera, and we did a whole lot of research on this. We looked at the impact of 1316 beta-glucans on xenografts in animal models. Again, no problems.
Okay, wonderful. So Den is asking, Dr. Paul, why would surgeons tell people to stop taking fish oils before surgery? And does that also include the balance oil?
Oh, yes. Now, the reason why they do that is because that if you're ever in an operating theater and you see them cutting open a patient who's taking, let's say, aspirin, once they make the cut, their tissues will tend to ooze through capillary bleeding into the operating field. And the surgeon doesn't want that. They want to keep it as dry as they can so it's clean so they can see what they're doing. If you're taking fish oil, the same thing happens. You get rather more oozing. The surgeon can get around that simply by using an additional drain in the operating site. So there is a fix, there is a way around it, but it's just they prefer to keep the site a little drier if they can. So they'll typically say, stop taking fish oil for a week or so before you come in.
Okay, wonderful. So Kelly wants to know a little bit about, you just told your story in regards to helping with your own autoimmune disease. So what were you doing to do that? What were you taking? Were you taking the balance oil or were you also taking something else?
No, I was simply using balance oil, or rather balance oil did not exist at that time. I took a prototype of balance oil, which I made up myself. So I was simply drinking lots and lots of fish oil, combining it with olive oil, and drinking it in very large amounts and gagging a lot, trying to keep it down, not always succeeding, but getting to the point where my immune system could no longer mount a chronic inflammatory response. And at that point, the immune system, I think, said to itself, well, maybe this isn't a target that I should be aiming at. And after about 2 or 3 months of this, my immune system forgot its target. So when I stopped taking this ghastly mixture of oils, the problem didn't return.
Okay. Wonderful for getting that information there. Okay, so Emma's wondering about Xenobiotic. And so when you are taking Xenobiotic, it's actually targeting different areas of the gut and specific to targeting and giving like food for the good bacteria and not for the bad bacteria? Or how is that at a certain part of the gut? How does it really work, the Xenobiotic?
Well, you're providing fuel to a group of bacteria which are gram-negative and which are probiotic. And the more you give them, the more they grow. And as they grow, they do 2 things. Firstly, they kill off a lot of the bad bacteria that you don't want. But the other thing is, as the good bacteria grow, they pump out compounds known as postbiotics. There are many of these, and the one that most people focus on is butyric or butyric acid. And butyric acid is really, really interesting and very important for our health because it is a potent anti-inflammatory, not just in the gut, but it spreads out in the rest of the body as well. But it is also extremely good at killing cancer cells. So if you have a gut that is full of the right bacteria and you're giving them the right food, that's very protective. And all the metadata says that if you keep up a healthy microbiome using things like Xenobiotic, it cuts your chances of early, which means avoidable, death by about 30%. It's huge.
Okay, so I needed to put my glasses on to read this one here. So there's a question from Norway who is actually asking for their team member, Steve. He says, okay, so you get a good omega-6 balance, then the nutrition will be transmitted more easily through the cell membrane. But do you know if the component in the health protocol that will speed up the exchange of sodium and potassium ions over the cell membranes, thus increasing mitochondrial activity, the ATP, and cell activity level? If yes, which ones and how?
I'm not convinced that changing the 6:3 ratio is going to affect the functioning of your iron transport pumps. And there's several of these, and they're involved in a lot of different aspects of cellular function and tissue function as well. If what you want to do is to improve mitochondrial function, I would suggest using the mitohormetic approach. And probably the best one of those that we know of is using near infrared. So there is a laser system that is currently in use. There's a company called Lima Life or Lemur Life in the UK. I have advised them in the past, and they have a handheld laser which delivers exactly this frequency. They're using that to demonstrate, I mean, amazing anti-aging results. It's a cosmeceutical thing. They're using it to reverse aging of the skin, and it works really well because it's upregulating, amongst other things, ATP synthesis. If you want to do this in a more systematic way, you would actually sunbathing is not a bad way of doing it. The problem with sunbathing, of course, is as well as your near infrared, you're getting UVA and UVB, and some of that is useful. You're producing more vitamin D in the skin, and some of it is not so useful because it's accelerating skin aging and is potentially, raising the risk of certain types of skin cancers. So there are near infrared saunas that you could use. That's another interesting approach. And there are people I know who use those and like them very much.
Okay, wonderful. I didn't even understand the question. That's why I read it. So I'm glad you could get that, Dr. Paul, and thank you. So Michaela is asking, if someone has low levels of platelet action, is omega-3 positive or is it a bad idea?
Do you mean to say if you have very low platelet counts?
Yes.
If you have very low platelet counts, then that may be indicative of another problem, which balanced oil is not going to affect. Why don't I just come in with you? I'll carry on talking. All right. Okay. All right. Okay. So I'm just going to move around a bit here. If you have a very low platelet count, that may be indicative of a different type of problem. You may have a degree of bone marrow suppression. And I think if that's the situation, what I would suggest you do is to take the 1316 beta-glucans, which are really, really good for bone marrow function and for erythropoiesis in general.
Okay, wonderful. Okay, so Dr. Paul, is there a time that you're going to recommend balance oil premium versus regular balance oil? Okay, now we're getting a lot of feedback here with the wind. We'll see how it goes when you're going to answer that in regards to balance oil premium. Is there certain times you would recommend that?
Yes, the premium simply has a higher content of the polyphenols. And what that means is because the polyphenols have a direct and very rapid acting anti-inflammatory activity of their own, you might want to use the premium oil if you have a current inflammatory problem that is causing pain or disability. Because of the high polyphenol kick, they will start to, the premium will result in clinical benefits coming along rather more quickly than if you'd used the standard balance oil.
Mm-hmm. Wonderful. Okay, so question, do you need to use the Xenobiotic within a certain time after mixing it with water? Do the prebiotics lose their effectiveness?
No, they don't. The prebiotics are very robust fibers. You can mix them in water, you can mix them into ice cream or custard or stew or porridge, you can bake them into bread or biscuits. They'll withstand it. They're out there, they're pretty stable.
Okay. So is there anything in Viva that would be causing any bloating or swelling?
Not that I know of, no.
Okay.
Unless, and this is very rare. I mean, if you have a saffron allergy, and I have heard of this, but I think it's pretty rare.
Okay, wonderful. So I have a Dr. Roy who is asking, how does the balance oil for brain development?
Well, it's got all the DHA the growing infant brain needs, and all I can tell you is that I've seen a lot of balanced babies now. And when I go to the Xeno events, I've learned to recognize them. So I've seen these infants at anything from 2 months up to 2 years, And the one thing they have in common is that they're very alert, but they don't cry. You know, they're interested, they're looking around, they don't get upset, they're very even-tempered, and they're really awake and focused. So that's indicative of really good brain development. It's a way of reducing inflammatory stress in the mum who's taking balance oil. And the important aspect of that is inflammatory stress during pregnancy has now been identified as a absolutely key causative factor for spectrum disorders. So, you know, Asperger's, autism, ADD, ADHD, dysphasia, dyspraxia, they're the result of the brain wiring developing incorrectly in utero, and that is a direct response to chronic inflammatory stress in the mother. So by the mother taking balance oil, you're achieving two things. You're reducing inflammatory stress during pregnancy and protecting the infant's growing brain, plus you're giving the infant all the omega-3s it needs to build its brain as effectively as it possibly can.
We're getting quite a bit of feedback there. It looks like you're ready to order your next drink here, Dr. Paul. Are you gonna eat soon, maybe?
Not a drink, a really unhealthy lunch, which I'm not going to show you.
Okay. Okay. Well, we're glad we're all partners here asking questions. You'll have to say hi to Madeline across the table, I'm assuming. So, okay, and here we go with the next one. The doctor is telling them not to take balance oil because of an arterial aneurysm.
If you have an arterial aneurysm, you have to get that fixed. That's the most important thing. So if this is a patient that's going to go for surgery, fine, and after the surgery, they can take balance oil as before. If the aneurysm cannot be accessed surgically, then I would think the most important thing to do there is to make sure that the blood pressure is kept low. And balance oil can help you to do that, but there is a role for antihypertensive medications as well.
Okay, so Val is asking, why isn't there calcium in Extend?
Because too many people are taking too many calcium as it is. Firstly, there's no point in taking calcium to protect your bones. We know it doesn't do that. There's plenty of studies that show that it's completely ineffective with or without vitamin D. In fact, all the evidence says that the more calcium you take, the more you die. You know, you don't want excessive calcification in your soft tissues, including your blood vessels. So the question then is, why do so many people have osteoporosis? And that's actually nothing to do with dietary calcium levels at all. It's to do with a much more complicated form of nutritional and metabolic imbalance, and that is actually addressed by the health protocol.
Okay, wonderful. So Dave is asking, why is it that in some cases, the omega-6 balance goes up on the second test instead of going down?
You know, that's really odd. I've seen that in a handful of cases, and I don't fully understand it. I think that what may be happening is that it's what we call compensatory behavior. And people feel, well, I'm taking balance oil now, so I'm safe and I can eat whatever I like. And then their diet goes to hell and they start eating all the wrong kinds of foods. I think sometimes it's compensatory behavior, as I said. In other cases, they may not be taking the right dose. They may be taking the balance oil too close to a period of exercise and simply not getting any of the benefits of it. That's about the best I can come up with.
Okay. So Ilona is asking, oncologists are telling their customers that they cannot take any Xeno products during chemo. What are your thoughts on that?
I think that's very cruel of them to say that. In general, people who are receiving chemo, which is pretty barbaric, they'll run into all kinds of problems, typically in the gut, that they're not using cold caps, hair loss, and all the rest of it. Some of these problems can be reduced and avoided altogether if you're using the health protocol. So, for example, bone marrow suppression is far less if you're using the health protocol, and the gastrointestinal tract isn't as badly damaged either. The problem is that we've seen this happening. People who are taking chemo, sometimes their doctors will say, well, if the chemo isn't hurting, it's not working. They're taking the health protocol, they're doing really well, and the doctor then thinks, oh, I can ramp up the dose of chemo, and then they kill their patients. I've seen that happen. We should be aware of this problem.
Okay. So you mentioned before regards to when people maybe trying the Aqua-X in regards to somebody had to remove the gallbladder. If they're not able to take the Aqua-X or having effects like that, what can they then do?
I missed a part of that question. What is the problem with Aqua-X?
So if someone is not able to be taking the balance oil, they've tried Ascent, they've tried Aqua-X, what could they otherwise do?
So they can't use the Aqua-X either, is that what you're saying?
Correct.
Why can't they use it? What is the problem?
They're still having issues with their, you know, it's still affecting them the same way that it did when they were trying the balance oil or Ascent, and the Aqua-X doing the same thing for them.
Then I think what they may have is something called Exocrine pancreatic insufficiency. So if the pancreas isn't producing enough lipase enzymes, that creates steatorrhea. You simply can't absorb the oil or the fat. It gets into the large bowel, causes the same problems as you find in people who have a cholecystectomy. If you've had exocrine pancreatic insufficiency, you can get around that to a large extent by taking an exogenous lipase enzyme together with the balance oil. It's a pain having to do that, and you may well have other symptoms if you really do have EPI, exocrine pancreatic insufficiency. Probably worthwhile getting that checked out.
Okay, we're going to get down to the last two questions here because I booked Dr. Paul for an hour and I know he's going to be ready here for the last couple of questions. So taking the products like the polyphenols together with the protein, does that affect absorption?
There is some evidence in the literature that suggests that if you're eating the proteins with the polyphenols, the proteins may bind the polyphenols and reduce their uptake. I'm not convinced by that because what typically happens is that the proteins then they're digested, they're broken down into peptides and amino acids. And at that point, if a polyphenol is attached to any one of those amino acids, and polyphenols do have a high affinity for proline and hydroxyproline, they'll then be absorbed through the gut wall along with the amino acid. So the answer is it doesn't seem to be a problem. In practice, it does not seem to be a problem.
Okay, we're going to just do one last question, Dr. Paul here, and that is that most of us as partners are recommending the health protocol or the health protocol premium to absolutely everybody, because that's what we truly believe in for ourselves and for our friends and family. So we want to share that with everybody. So what would you do in regards to recommendations for children? Would you also be recommending the health protocol for children?
Look, I don't want to medicalize everybody. I mean, I'm not convinced that everybody needs every product. I mean, if everybody took them, would public health be better? Undoubtedly. But if the child is physically active and is eating a varied diet, they probably don't have a degenerative disease. If they have an allergy, let's say, or they have a very specific health problem, then we may be able to help with a solution. But if they're well, eating a varied diet, they probably don't need very much of what we have to offer.
Okay, wonderful, Dr. Paul. You know, I think it was important, and I know that you can't see this, but there's more than 200 people on this Zoom, so I can really tell that this is going to be something we're going to need to do more often, Dr. Paul, because there's quite a few questions that not everybody got their question answered in this hour, which is crazy because we asked you many questions. So we'll be setting up more times to do this, Dr. Paul, to get all their questions answered and get that done before your dinner comes with Madeline there. So I'm going to thank you for your time, Dr. Paul, and thank Madeline for sharing you with us. And from all of us here, we thank you for asking all of our questions, and we're going to do this again. So those of you who didn't get all of your questions answered, I'll set up a new date with Dr. Paul to do that. So I'm going to let everybody unmute and say thank you to Dr. Paul.
Thank you, Dr.
Thank
Paul.
you, Dr.
Thank you so much.
Thank you so
Dr.
much.
Paul.
Thank you so much.
Thank
Thank
you.
you, Dr. Paul.
Paul.
Thank you. Thank you.
God bless.
Thank you. Have a good night.
You're very
Thank
welcome.
you so much for everything.
Thank you.
Thank you.
God bless. You are blessed. Thank you.
Okay. Thank you so much.
Thank
Bye-bye.
you.
Thank you, Dr. Paul.
Goodbye. Auf Wiedersehen.
Bye. Take
Presentation,
care.
sir.
Take
Good
care.
presentation.
Tanya,
God bless you.
until the next
I am
time.
Sajul
Bye,
Islam
Kalam.
from India.
Okay.
God bless. Thank you.
Congratulations, 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 congratulations.
Donkey.
Thank you, everybody.